Well, now it's time to talk about ESMO's position paper on palliative and supportive care. And here with me to tell us a little bit more about that is Dr. Wendy Oldenmenger on the end, and also Professor Karin Jordan. Welcome to you.
Thank you.
So, Professor Jordan, first of all, what's the focus of the ESMO position paper?
It was published early this year in Annals of Oncology, and actually it is about supportive and palliative care. So this means how can we best integrate supportive and palliative care, meaning kind of patient-centered care in the continuum of cancer care.
And what are you saying? Are you saying that happens well at the moment, or it doesn't happen so well?
I think it might differ from country to country, but actually I think there's still a need to better integrate patient-centered care, meaning, for instance, having a multidisciplinary team to assess the toxicity of some certain anti-cancer therapy, to monitor and to manage this within a multidisciplinary team. And ESMO actually again calls for it, and I think that is really important.
And Wendy, how important do you think supportive and palliative care are in the overall support of a person with cancer?
I think it's really important because in the first stage in patients having the treatments and the adverse events are really important in that case. Also, if they can follow the treatment, and later on when patients are more progressive in progressive disease, many of them have symptoms there, and it has a huge impact on quality of life. So yes, it's really important that we have an attention for that.
And what kind of things do patients ask you for that you can help them with and you can help to relieve their symptoms?
Most of the time that's just be there, ask for it. It's very important that we systematically ask if whether patients have symptoms or adverse events, and we can manage that. And for many symptoms also, we know that there's a huge chance that patients will have that kind of symptoms, and we can also be proactive. And when we have a multidisciplinary team there, we can work together with that, not only with the oncologist and the cancer nurse, but also with the psychologist and all the others.
And what are the challenges, would you say, in delivering really good palliative care?
Having a timely intervention, that is an obstacle, and also in the routine cancer care, what is also an obstacle is active listening to the patient and hear the voice of the patient when it comes to symptoms or social needs or spiritual needs. We really need to assess this and then having a strategy.
And all countries have constraints on their budgets, don't they, on their healthcare budgets? It costs money. So how can we make enough time to make that good level of care?
I think use the new possibilities like e-health. Almost all people, even the elderly people, have access to the internet, and we have many web applications we can use to really closely monitor, even when they are at home, and proactively help patients when they have psychosocial or physical complaints there. We can help them. They don't need to come to the hospital. So I really believe there that it's time-consuming for patients, but also for the nurses and the physicians there, but also that we can help them to have a better quality of life there.
And how do you see the future of palliative care looking? How would you like it to look?
I mean, we have to invest a lot of research. This is absolutely clear. And what I would like to emphasize is that we have indeed to put a lot of attention into the patient-reported outcome assessment, what already was pointed out, to better monitor the symptoms. And we really need to better understand the side effects of the new anti-cancer treatment. I think we really need to focus on this one. And what is important to me is that we sometimes put too much attention on the overall survival of the patient, but we also have to pay attention to the side effect management and other needs of the patient. Mm-hmm. This means for me continuum of cancer care and patient-centered care.
You're nodding at that, you're agreeing.
Yeah, totally. And most of the time what we see as health professionals, we only look at the most serious symptoms. But that doesn't mean that those symptoms is also the most important symptoms for those patients. But we see that patients who have complaints like nausea and vomiting, that they say, oh, it's not as serious as the pain or whatever, but it's for them the most serious one because they can't eat with their family when they're at home because they're too nauseous.
This is it. Really interesting topic. Thank you so much, both of you, for coming in to talk
Thank
to
you,
us.
pleasure.
Thank you very much.